Hi everybody, Dr. Ahles here. In this short video, we're going to talk about the valves, which are structures that we use to divide the chambers of the heart from each other. When we're thinking about a physiology of the valves, what their primary job is, let's underline, highlight, star, flowing in the correct direction. The goal of a valve is as blood is moving through the heart, we don't want it to go backwards. We want it to go into the chamber that we're trying to push it into. So, valves important for us to keep blood flowing the correct direction to maintain either, like we talked about on the right side, the pulmonary circulation, or, like we talked about on the left side, the systemic circulation. So let's trace the flow of blood through the different valves that we find in the heart. The first valve that we find in the heart is what's called the tricuspid valve. Sometimes you'll hear the tricuspid valve called the right atrioventricular valve. Hey, this name, atrioventricular, tells me exactly where I find this valve. It's between the atrium and the ventricle, and it's on the right side. So the tricuspid valve, what I find between the atrium and the ventricle, on the right side. This valve has blood that's coming from the right atrium going into the right ventricle. So as we consider the flow of blood, when blood first gets into the right atrium, the first valve it passes through is that tricuspid valve. Now that blood is here in the right ventricle, and I'm going to push that blood up through the pulmonary artery or the pulmonary trunk. But to get there, I have to go through the pulmonary semilunar valve. Semilunar means half moon. When we look at the structure of this valve in a moment, that half moon thing will make sense for us. So the pulmonary semilunar valve, I find that inside the pulmonary artery. The blood that's going through the pulmonary valve is coming from the right ventricle, and it's going into the pulmonary artery, remember, ultimately out to the lungs, where we're going to get oxygen. Now that blood is coming back from the lungs, and as it goes back into that left atrium of the heart, the next valve it's going to bump into is called the mitral valve, or the way I like to talk about it, the bicuspid valve, because that gives me a little better idea of what it's made out of. Bicuspid means two cusps, where this tricuspid valve we talked about before means that we have three cusps. So let's go back over here to the left atrium. When blood comes into the left atrium, we squeeze this chamber to push it down into the ventricles. So blood passing through the mitral valve started in the left atrium, and it continued down into that left ventricle. But once we get it into the left ventricle, now our job is to get it out to the entire body. And the way we get it out to the entire body is by passing it through the aorta. So the last valve that blood is going to go through is called the aortic semilunar valve. The aortic semilunar valve takes blood from the left ventricle and pushes it out into the aorta. Once it's in the aorta, it can go to the entire body. So let's look big picture at the functioning of the heart. When we look at those valves, when they'd be open or closed, when we have a relaxing ventricle, so this word diastole means relaxed, when the right ventricle is relaxed, the cuspid valves, tricuspid on the right, bicuspid on the left, are open. Blood is flowing down from the atrium into the ventricle. We need these cuspid valves to be open. So diastole, resting for the ventricles, that's when the cuspid valves are open. This allows the ventricles to fill. But when the ventricles are contracted, we open up the semilunar valves. Remember that the semilunar valves were what we found in the pulmonary trunk and in the aorta. So because I want my blood to leave the ventricles, I'm going to create an exit for them with these semilunar valves. When I want that blood to go into the ventricles, I create this open door, which is those cuspid valves. When we talk about how these valves open and close, they work a little bit differently from each other because their structures are different. So let's start with the cuspid valves. Remember that the cuspid valves are the tricuspid valve, that's on the right side of the heart, and the bicuspid valve, which we find on the left side of the heart. These two cuspid valves are going to open when the blood that is above them, or in other words, in the atria, push down on them. So my cuspid valves have a smooth surface for blood from the top to push down on them. Once we finish with pushing that blood down, when the ventricles start to contract, we push the blood up, and a lot of that blood gets caught in the cusps of these valves. But the other way that we ensure that blood doesn't pass through this valve when we're contracting the ventricle, let's underline, highlight, star papillary muscles. We briefly talked about the papillary muscles when we were talking about the trabeculae carnae. Remember that we said there were some extensions coming up in the ventricles, those special papillary muscles. These contract specifically when the ventricle contracts to make sure that this valve stays squeezed shut. So cuspid valves open when blood on top of them pushes down. They close when blood below them pushes up, and when these papillary muscles contract to make sure that that blood doesn't get through. With our semilunar valves, remember that we had those two, the pulmonary semilunar and the aortic semilunar. Remember that the pulmonary semilunar is found on the right side. It's off of the right ventricle, whereas the aortic semilunar is found on the left side, off of that left ventricle. Semilunar valves actually function opposite to what we saw with the cuspid valves. So when we have blood below a semilunar valve and it starts being pushed up because the ventricles are contracting, that actually pushes open the semilunar valves. And when the contraction ends and the blood starts to try to flow backwards, back down into the ventricles, that's what's going to push closed these semilunar valves. So as you're considering these valves, number one, we need to know where they're located. And number two, we need to know which direction they're trying to make blood flow into compared to which direction they're trying to stop the blood flow from. So in the case of the cuspid valves, we want blood from above us to go down, whereas with the semilunar valves, we want blood that's below us to go up. That will help you keep straight which way we open or we close. So I mentioned this just a little bit, but when we're talking about things like the tricuspid valve and the bicuspid valve, these two valves have a different number of flaps. Flaps are essentially just the structures that open and close. So the tricuspid valve that we find on the right side of the heart, tricuspid, like its name suggests, has 3 flaps. So we can see those 3. By the way, I know this is a weird picture, but imagine that you took a heart and we cut it kind of like this. We cut off the atria and we're looking at those bicuspid valve and tricuspid valve, as well as those valves inside our blood vessels. So tricuspid valve on the right side, bicuspid valve on the left. These two have cusps, remember, that open when pressure comes from the top. The semilunar valves, which are the aortic semilunar valve and the pulmonary semilunar valve, these both have 3 flaps. So the number of flaps is not different when we compare the two semilunar valves. Remember I told you semilunar means half moon, so these little flaps are kind of like a half moon that we see here. And remember, like we talked about previously, what pushes these valves open is when blood below them squeezes up. When blood tries to fall back down on top of these, that's actually going to pull these ones shut. So when we think of these valves, like we talked about before, we stop the blood flow that's found underneath the cuspid valves. We keep that blood in the ventricle. We won't let it go back to the atrium. Whereas those semilunar valves, we catch blood that's above us from the aorta or from that pulmonary trunk. Let's look at another weird picture. Now imagine that we slice the heart in half. We have the left side over here and the right side over here. We can see all four of those chambers in this view. So I've got the right atrium and the left atrium where blood comes into the heart. Then I have my left ventricle and my right ventricle. Here's a little wink, wink, nudge, nudge for you. Even if we didn't know which one of these was the mitral valve or the tricuspid valve, if you see how thick this myocardium layer is over here compared to the myocardium on this side, we could tell based on how thick the myocardium was that this is the left side. The left side always has the thickest myocardium. When we compare the ventricles to the atria as well, notice that there's so much more myocardium in the ventricles. They have to work so much harder. When we look at this view, the reason I wanted to show you it all funky is because the tricuspid valve and the bicuspid valve attach to those structures that we call papillary muscles. So the papillary muscles labeled really well in this picture. The papillary muscles are the muscles that are inside the ventricles that are attaching to these valves, determining whether they're open or closed. So a new word for us that I'm going to toss out, these little white stringy structures that we see here are called the chordae tendineae, also known as literally the heartstrings. So the heartstrings attach to the flaps of these two valves when the ventricle is contracting, when the bottom part is contracting to push blood out of the chamber. The papillary muscles will contract with it as well, because when they contract, blood will push up against the flap, but making this tight means that blood won't be able to push back up into the atrium, or it won't be able to push back up into the ventricles. So we want to know with these valves, how many flaps do they have? Which side does blood pass through, or which side does it get caught? And we also need to know a little bit more about those cuspid valves. As you're considering what we just talked about, I want you to take a little time to put these valves opening and closing in terms of pressure. So when we're thinking about opening up the bicuspid or tricuspid valve, we have to squeeze something to help our blood move. So remember that the bicuspid and the tricuspid valve opened when the blood above them pushed down on them. If the blood above is pushing down on me, that means that my upper chambers, my atria, have higher pressure. It's pushing the blood into a lower pressure chamber. When I think about the semilunar valves, these were the valves that prevented blood from flowing back into the ventricles. What gets these valves to open up is when the ventricles have really high pressure. High ventricle pressure pushes open the semilunar valves. When we think about closing the bicuspid valve and the tricuspid valve, remember that these were slammed closed when the blood below them pushed up. When the blood below is pushing up, my ventricles are contracting. The ventricles must have higher pressure. When the semilunar valves are being pushed closed, my ventricles are relaxed. If my ventricles are relaxed, my atria will have a higher pressure to them. Blood is starting to work on flowing back into the heart, and that's going to help to increase the pressure in the atria since the ventricles have such low pressure. So big picture summary. When we talk about the valves, know their names, know their locations, know their specific structures. How many cusps do they have? Do they have those chordae tendineae? And know when they open and closed based on the contraction of different heart chambers, or like we did with this activity, based on pressures.